Can you hear me?
Yes, we can. Thank you.
Great. Thank you. Apologies for my timing. I'm sorry, Mark. I didn't realize we were all virtual today and was running to the room to lead grand rounds off in person. So good morning, everyone. Apologies for the delay. We'll get started now. Delighted to welcome everyone to this morning's special Grand Rounds. Before I introduce our presenters, I want to share a land acknowledgement. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them in this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis peoples and their valuable past, present, and future contributions to this land. This morning, we have the pleasure of hearing from Dr. Mark Tremblay, Dr. Maeghan James, and Carolyn Fornataro. Dr. Mark Tremblay is well known to many of us. He's a senior scientist with the HALO research group at the CHEO and a professor of pediatrics in the Faculty of Medicine at the University of Ottawa. He is a fellow of the Canadian Society for Exercise Physiology, a fellow of the American College of Sports Medicine, a fellow of the Canadian Academy of Health Sciences, president of the Active Healthy Kids Global Alliance, founder of the Sedentary Behavior Research Network, president of Outdoor Play Canada, and adjunct visiting professor at 5 other universities on 4 continents. So he's not busy at all. Dr. Tremblay has published more than 600 scientific papers and book chapters in the areas of childhood obesity, physical activity measurement, exercise physiology, sedentary physiology, outdoor play, and health surveillance. Dr. Maeghan James is a postdoctoral fellow with the HALO group, working with Dr. Tremblay, and her research focuses on inclusive active outdoor play and its role in supporting health and development in early childhood for children of all abilities. And Carolyn Fornataro is a special education teacher with a passion for teaching outdoors. Prior to working in education, she worked in therapeutic recreation for the city of Ottawa for more than 10 years, and her practice has evolved to the physical education, health, and being the core French teacher at the CHEO school. So really delighted to welcome all of our presenters. Today, they're talking about promoting child health through active outdoor play. Over to you, Mark.
Thank you very much, Jason. Good morning, everyone, and welcome to CHEO Grand Rounds. So this is a 3-part presentation. I will go first, and we'll hover around 30,000 feet over this issue and explain things to you. I will then pass it to Maeghan, who will talk to you specifically about research in this area that's happening at the CHEO, who will then pass it to Carolyn, who will talk to you about how this is being implemented, at least at the CHEO school, right within CHEO. Okay, so we'll kind of go high and zone in. Specific objectives for the day are to understand the importance of outdoor play for supporting healthy child development and learn about key findings from the new global position statement on active outdoor play. You'll then learn about the CHEO-led Sprout and Sprout-Able research projects, and Maeghan will explain those, and then explore current outdoor play initiatives at CHEO and discuss opportunities for further action, especially through a few inspiring stories that Carolyn will share with you. Next slide. Okay, so part 1. So today is the day before the official launch of the 2025 Global Position Statement on Active Outdoor Play. You're getting a sneak peek of this. I'm going to present some of the information from it and explain how it was done. I encourage you to get excited about this, but to not share this until tomorrow morning at this time when it's officially unembargoed. So next slide. So I just want to set the stage so you kind of know where we're coming from on this. And I'm going to read this from a colleague's commentary that he wrote on the previous position statement that I led. I've seen several public health messages that advise people to avoid going outdoors at dawn and at dusk during peak mosquito hours. Also in the early morning and late afternoon during peak traffic hours, and from late morning to late afternoon during peak sunlight hours. And of course, children should not go outdoors if it's hotter than 30 or colder than -20 and or dark outside. If parents and caregivers paid attention to all of these messages, they would believe it's never safe for children to go outside and be active. these messages that public health bodies convey about the outdoors need to change from avoidance to adaptation and mitigation. For instance, if it's raining out, kids should not be told to stay indoors. Rather, they should be encouraged to put on a raincoat and rubber boots and go outside and jump in a puddle. And this sort of summarizes the context of things about 10 years ago in Canada, where we had this juxtaposition of research evidence and the advice that public health authorities were giving. And so what I wanted to do, next slide, please, was to gather people together to get at the truth. Let's stop cherry picking the good or the bad evidence to make our point, and let's be able to provide evidence-informed advice. And why should we do that? Well, because the evidence is pretty darn clear. Active outdoor play is good. It's good for all aspects of holistic health, and the benefits outweigh the risks. Next slide. So in 2014, I gathered together a number of disparate groups from around the country to create a position statement on active outdoor play that was released in 2015. And the position statement in summary says, access to active play in nature and the outdoors with its risks is essential for healthy child development. We recommend increasing children's opportunities for self-directed play outdoors in all settings, at home, at school, in childcare, the community, and in nature. And that position statement was informed by 2 published systematic reviews. It had the cooperation and detailed meetings of 14 organizations, including the Canadian Pediatric Society and Parachute, these sort of risk avoidance groups at the time, at least. There were over 400 public supporters of the position statement, which was endorsed by the Council of Chief Medical Officers of Health and eventually replicated by the Canadian Public Health Association and the Canadian Pediatric Society. There's a research grade report that's open access if you're interested in that. This is old news now, and a public facing document. So that was done in 2015. Next slide. And it had a huge impact in Canada. We released it in conjunction with the release of the Participation Report Card on Physical Activity of Children and Youth. And it got over 300 million media impressions across the country, and it just kept keeping alive to the extent that it was used to set legal precedent in Canada. It's been used to shift municipal policy, to influence school culture. Canadian Mental Health Association used it as a basis of a mental health resource. Tons of money flowed from the charitable and philanthropic sector into this particular field, which then cascaded further forward. There was wide support and replication, and it led to the creation of the not-for-profit corporation Outdoor Play Canada, of which I have the privilege of serving as president. Next slide. And so 2.5 years ago, almost exactly, I thought, this has had great impact, better than what we thought. How can we springboard off that with the 10th anniversary that was coming up to keep it alive, to reignite and re-energize the movement to get people outside? And we wanted to not only update everything with 10 more years of research and evidence and so on, but we wanted to move the initiative from being Canadian-centric to global. People around the world were using the previous position statement, and we wanted to fully embrace that and embrace the different cultures and the different climates and situations around the world. So we wanted to make it global in scope. We also wanted to extend it from just being children to being all of the population. I believe I can go out and play just like my kids can go out and play. And we wanted everyone to be aware of that and to embrace that and use that. And we wanted to extend our focus from being primarily health and well-being to being focused on a much broader base of things that were connected to the United Nations Sustainable Development Goals. That is how it is useful for communities, for environments, and for the planet, in addition to individual level things. Next slide, please. So we went through a detailed process, as you can imagine, over the last 2.5 years. We created a 143-person steering committee from 32 countries, so we'd have broad perspectives on this. Next slide. And we used that steering committee through an an iterative process to create a conceptual framework that would anchor the work that we would do to create the position statement. So through a series of surveys and so on, with the steering committee, we ended up with 9 core themes that recognize both risks and benefits. There are risks and benefits, but the benefits far outweigh the risks, and we spend far too much time and focus on the risks without paying attention to the benefits. And so we ended up with these 9 themes: education and learning, movement behaviors, health and well-being, One Health, nature and the environment, human rights and policy, community connections and partnership, social capital, and a catch-all emerging areas that we knew we didn't capture everything that could be related to active outdoor play. Next slide. So that conceptual framework was the anchor upon which we started to gather evidence. We said, okay, we've agreed that this is the conceptual framework. Let's do all the grunt work to find out the best available evidence related to that. And so we conducted 12 systematic reviews related to these. These are all either published or under review at the moment. Next slide. We also wanted to understand the contextual differences around the world. And so we also did 6 narrative reviews, 1 for each of the United Nations geographic areas of the world, as you can see on the map here. And here we wanted to understand the state of research, leadership, policy, and culture surrounding active outdoor play and how it varied around the world. Next slide. So with the conceptual framework there and these 18 reviews done, we drafted a position statement at a workshop that we had in Seoul, Korea just before Christmas last year. We polished that and circulated it to the steering committee. You can see the results there, very high agreement, but we had 86 comments that we brought in. So we did a massive revision to it, sent it out to them again, got almost perfect agreement, but still got comments, most of which were great work, this is good as it is, and so on, but still some changes. We made further changes, and we went back a 3rd time to the steering committee and also asked them to snowball the results out to their communities. And so we had a much larger audience, much greater feedback, and you can still see 97% agreement, but 270 comments. So we made revisions again. Next slide. And after probably 100 different iterations of this, some of which happened as late as yesterday, this is the final position statement that will be released tomorrow. So this is the 2025, the 10-year anniversary position statement on active outdoor play. And the highest level statement says that active outdoor play promotes holistic health and well-being for people of all ages, communities, and environments, and for our entire planet. It is critical given the multiple global challenges we face today, for example, social and health inequities, climate change, digital addiction. Together as a collective of the outdoor play sector, we recommend increasing opportunities for active outdoor play in all settings where people live, learn, work, and play. To achieve this, it is important to collaborate across sectors, settings, and societies to preserve, promote, and value equitable access to active play outdoors and in nature. That's the high-level statement. It's a 7-page document. Next slide, which will be available to you tomorrow. And in it, we have a series of information nuggets that are based on the entire systematic reviews. So full systematic reviews, sometimes on more than 200 papers, and we narrow them down to about 10 words. So active outdoor play helps us move more, play longer, and sleep better. Next slide. Active outdoor play is a catalyst for sustaining health and well-being. Next slide. Active outdoor play promotes confidence naturally. Next slide. Active outdoor play offers a pathway to a happier, healthier planet. Next slide. Active outdoor play builds climate resilience and stewardship for a sustainable future. Next slide. Active outdoor play connects communities. Next slide. Active outdoor play facilitates diverse learning opportunities across all ages. Next slide. And active outdoor play can reduce excessive indoor time. Next slide. And in addition to the nuggets that summarize the systematic review evidence, we end with a call to action, recommendations for promoting outdoor play. And we have specific recommendations for societies, for research and surveillance, for policy and legislation, for education and schools, for public health and healthcare, for urban planning, for communities, families, and individuals. I'll go through just 3 of these quickly just now. Next slide. So for public health and healthcare related to you on this call, we want you to educate medical professionals, patients, and communities on the health benefits of active outdoor play, and to integrate active outdoor play into healthcare practice and public health initiatives to reduce sedentary behavior and improve health, and collaborate across sectors outside of just the health sector to develop localized public health strategies that promote active play. Next slide. For families, play with others, including companion animals, to nourish a sense of community and connection to the outdoors. Encourage and model active outdoor play as a normative behavior in your neighborhood. Support family members' participation in active outdoor play by encouraging, facilitating, and engaging together. Next slide. And at an individual level, be respectful stewards of the outdoor environments where play happens. Advocate for equitable access and preservation of green spaces and safe, play-friendly environments. Explore and enjoy diverse experiences in different outdoor spaces as a part of your daily routine. Next slide. Consider endorsing the position statement. And so we made our slides 2 days ago when there were 275 supporters. When we started the meeting today, there were 324. So if you have FOMO, fear of missing out, join the movement and support the statement, which you'll get more information, hopefully see more information about this tomorrow. Next slide. The official position statement will be released tomorrow at the Breath of Fresh Air Summit being held at Wesley Clover Park. It's a 3-day outdoor conference. It will open with the release of the position statement tomorrow in the early afternoon. So if you're interested in that, you can find more information there. Next slide. We'd like to thank our funders, the Lawson Foundation and the Government of Canada and other supporters for helping to make this happen. And one last slide by me, the next slide. If you're interested in this, in more than just endorsing it, you can follow us, you can forward things, you can get involved, you can join Outdoor Play Canada or Play-Doh-Net. You can find out more about those at the Outdoor Play Canada website. Thank you very much for your attention. I'll pass the baton to Maeghan.
All right. Thank you so much, Mark. Hi, everyone. Good morning. Thanks for being here. So we just heard from Mark about all of the benefits of outdoor play, and I'm going to take it a little bit closer connected to the research that we're doing at the CHEO Research Institute. So we know that outdoor environments consistently offer richer, more diverse experiences for physical activity, exploration, and social interaction in children. We also know from longitudinal research that healthy behavior patterns begin to form in early childhood, and this often informs how we behave as adults. So this means that activity patterns of young children can set the foundation for lifelong health behaviors. So if outdoor play holds so much potential, the next question is, where can we meaningfully embed outdoor play into children's daily lives? So this is where my work has really focused in my postdoc currently. So really looking at the role of early learning environments. So many young children spend the majority of their waking hours in childcare. So these environments are not just care spaces, they're key developmental settings during these critical years. So this makes them a powerful point of intervention where we could actually reintroduce and reinforce outdoor play. However, despite the benefits, outdoor play is still not being a priority in many early learning settings. In fact, going outside has often become a nice to have rather than an essential part of the childcare day. Part of this issue is the persistent misconception that outdoors is a break from learning, while real learning only happens indoors. This mindset not only undervalues the developmental potential of outdoor environments, it also limits children's access to movement, exploration, all of the good things that we've been talking about so far on this presentation. So we have to think about shifting this perception and how do we change things in practice. And one thing that here at the CHEO-RI, and I'll speak a little bit about it on the next slide with a collaborative group that we've established, we've determined that we need high quality evidence. We need to clearly understand how spending time outdoors in the early years affects children's development, health, and well-being. And most importantly, we need to be able to show that increasing outdoor time during the childcare day does not come at the cost of other developmental domains, that it isn't just a break, that real learning and development is happening outdoors. And that's where the work of the Canadian Centre for Outdoor Play comes in. So the Canadian Centre for Outdoor Play is a collaboration between Outdoor Play Canada, so the not-for-profit organization Mark mentioned earlier, the Healthy Active Living and Obesity Research Group here at the CHEO led by Mark, Algonquin College, which is our local college in Ottawa, and Andrew Fleck Children's Services, which is a childcare provider in the Ottawa region. And together, this group has a commitment to advancing outdoor play and learning for overall health and well-being of children in Canada. So the CCOP is currently housed within the Forest Explorers building, which is an outdoor early learning center owned by Andrew Fleck Children's Services. It's located at Wesley Clover Parks, where the Breath of Fresh Air conference is being held tomorrow. It resides on 500 acres of forested National Capital Commission's land. So the CCOP is really a site that leads demonstration projects. It informs policy and practice related to outdoor play, provides professional development opportunities for people in the healthcare sector, the education sector, and beyond. And it's also a place where we conduct applied research, which I'll be talking about today. So just to give you a sense of what this childcare program looks like. So the childcare program is called Forest Explorers. It's an all-day licensed childcare center, and it takes place for the majority of the time outdoors on the land. So here are a few pictures of what these outdoor classrooms look like. And this program has spots for up to 72 children, and it has an infant program, a toddler program, and a preschool program. Just this summer, we did some research looking at how much time they actually do spend outside, and it's about on average 6 hours a day that they spend outside on the land learning and playing. So within the CCOP, our role from the CHEO is to actually evaluate this program. So using this as a demonstration site to understand how spending more time outside during childcare hours can promote health and well-being. So we are currently leading the Sending Preschoolers Outside study at the CCOP. And the primary objectives of the Sprout study are to examine child development and health in outdoor-focused childcare settings compared to conventional childcare settings, to understand how working in these settings, so for the early childhood educators, how this impacts their health, well-being, and attitudes towards outdoor play. And we also want to know how this could impact parental beliefs about outdoor play and learning. So the applied research that we conduct, it really happens here at the CCOP in what we call the research garden. So this is a dedicated space within the CCOP at the Forest Explorers building where we conduct assessments with children. For the Sprout study, it's a longitudinal perspective cohort study. I'll show you on the next slide a timeline here, but it's 3 years long, and we assess holistic health and well-being every 6 months. So we have assessments of physical, social, emotional, cognitive development, as well as measuring the 24-hour movement behaviors. And to do this, we use a combination of direct assessments with children. So you can see that on the pictures here, measuring fine and gross motor skills. But we also use accelerometry, that the children wear an accelerometer for a week. And we have parents complete a questionnaire. So this study, as I mentioned, is a 3-year study. We began the study in August 2024, where the Forest Explorers opened in July. So that was our first baseline assessments. We currently are just wrapping up year 1. So it's trickled into September a bit, where we're enrolling new families right now into the study. And we are currently in data analysis from our first year of the study. So just to give you kind of a snapshot of where we are at. So currently we have 118 children and families enrolled into the study, and we have 97 children who have completed their baseline testing. So I'll just show you here briefly what our cohort looks like so far. So we have 61 children in our experimental group, so those attending the Forest Explorers program. On average, they're 28 months with a standard deviation of 11 months, and we have a pretty even split between girls and boys. In our usual care group or active control group, we have a total of 36 children. And on average, they're about the same age as the experimental group, 29 months. And we have 56% of that group are girls and 44% are boys. So as we are embarking on the Sprout study, and as we're working through this first year of data collection, a question consistently was raised about children with disabilities. If outdoor play is to become a key strategy for supporting development and well-being, we realized it must be inclusive. We must be able to include all children in these efforts. So our approaches to promoting outdoor play cannot leave anyone behind. And that's why we developed a sub-study of the Sprout study called Sprout Able. And Sprout Able is funded by the Public Health Agency of Canada, and it's focused on understanding how we can best support children with disabilities in outdoor environments. We are also interested in understanding whether outdoor-focused childcare programs can truly meet the needs of children of all abilities. So just to give you a couple examples of what this research entails for the Sprout Able study, we're really interested in capturing diverse experiences from different perspectives. So about 6 months into the project, we wanted to understand caregiver and educators' perspectives on the Forest Explorers program when it comes to inclusion and accessibility. So we use something called the World Cafe approach. It's a qualitative method that moves beyond a traditional focus group and really empowers the participants themselves to help drive the conversation so that we ensure that we're having meaningful conversations about things that matter to not just the researchers, but also the participants there, so educators and caregivers. So we had families and educators come to the center and some community partners. We walked around the space, and then we spent a couple hours actually talking about the physical environment and the social environment in this kind of World Cafe setting. And from there, we were able to analyze notes and conversations. We also had a graphic recorder come to the session. So the graphic recorder was sitting in the session listening and then created this graphic recording of the meeting. And in consultation with our notes and our findings, we created this summary of the parent and caregiver perspectives about what's working and what's not working in the physical environment and the social environment. This was specific to the Forest Explorers program, but the idea of this is that this can be taken to other contexts as well to understand what might be needed to ensure that the physical environment and the social environment is accessible and inclusive. So just an example here in the physical environment in the bottom left-hand corner here of the graphic, a lot of the caregivers talked about actually the transition coming out of the built environment into the forest. So some people, there's a kind of this common misconception that being out in the forest is inaccessible. There's roots everywhere, there's rocks and sticks. But in fact, when you actually speak to families and people with lived experience, what we're finding is that truly the inaccessible piece of Forest Explorers is actually transitioning out of the building, the constructed person-built building, into the outdoor environment. And once you're out in the forest, children are resilient and they're able to navigate in these spaces. So most of the concerns around physical accessibility actually came from the physical building itself and not out in the natural spaces. From a social environment perspective, there was a lot of discussion around building trust. The outdoors is something that can be scary for a lot of families. So really the educators talked about their role in being able to support outdoor play and provide information to families. Another activity that we're doing in this Sprout Able study is capturing children's perspectives. And we do this through using GoPro cameras. So we have children who have a disability at the Forest Explorers program wear these chest-mounted GoPros, as you can see in the picture here, at the same time as one of their peers without a disability. And we record for about an hour as they're playing in their natural environment. We're doing a few different analyses, which include using a modified observation system, the OSRAC for developmental disabilities, which is a system of observation to record physical activity intensities. So we use a momentary time sampling technique to actually analyze these videos to understand what movement looks like in these outdoor environments. And then we're also using a qualitative perspective to actually go in and understand how play is supported during these different activities. So just to give you an example, so the first one here is in the infant class. So these kids were about 13 to 16 months. This was in the winter, and these GoPro cameras were on children while they were on their deck space and on a walk in the forest. So on the left here, you can see the breakdown of the movement patterns that we coded for a child with a physical disability compared to their peer without a physical disability. So we see ranges from stationary, and you can see the child with the physical disability spent most of their time in stationary position. The code limbs there means they're in a stationary position, but they're playing or moving their limbs of their body. And then we have slow or easy movement, moderate, and fast and hard effort. So you can see the breakdown here and see the differences compared between these two children. Another example here is from a preschool classroom, again in the winter, and this time they were out in the forest in their outdoor learning environment. And here we're comparing a child with a developmental disability compared to a child without a disability. And you can see the behavior patterns are actually quite similar. It's not quite the same as we saw on the slide before in the infant room with a physical disability. So what we're actually going to be using this information to do is look at in these different movement behaviors. So while they're stationary, while they're kind of in this moderate or fast physical activity state, what is happening in the outdoor environment? What is actually supporting these behaviors so that we can now have some evidence to actually teach others about how to support inclusion and accessibility and physical activity outdoors for children of all abilities. So just before I wrap up here, I wanted to share a little bit about how at the CCOP, we're really trying to bring research to practice. So a couple examples of what we've done so far, using the findings from the World Cafe, we've been creating a strategic plan for the Forest Explorers program to help guide their practice in accessibility and inclusion. And this will soon be publicly available and hopefully will be something that other childcare centers can also use to not only increase time spent outdoors, but to ensure that while we do this, we're doing this in a way that's inclusive and accessible for all children. We also work with a team of caregivers and educators and within our own research group to create modules and resources for educators and physical activity practitioners that show how we can be more inclusive and accessible outdoors. So really taking the findings from the Sprout study and the Sprout Able study and bringing it together into these modules, which will be available soon. And you can check those out on the Outdoor Play Canada website. And lastly, something we're working on right now, we're co-designing an inclusive outdoor play toolkit. So this is a project being led by a colleague, Dr. Kelly Arbanikotopoulos at the University of Toronto, who is a partner within the CCOP, and 2 occupational therapy students. So bringing in a rehabilitation science perspective to understand how we can do a better job at supporting inclusion outdoors and what we actually need to put into the childcare settings as a toolkit so that educators can provide high quality participation for children of all abilities. So those are just a couple examples of how we're really trying to bridge the research to practice gap. And this is something that's really at the forefront of the work at the CCOP. So a few take-home messages before I wrap up here. First is accessibility outdoors, specifically in natural spaces, is possible. And it may actually be easier than you think. So I mentioned it earlier. Most of the discussions we have around accessibility come from the building itself. Once we're outdoors, we've been learning that the outdoors really isn't built for anyone. It's built for everyone to be outside, and children are very resilient. And you'll hear from Carolyn shortly about some real life examples of how this looks. Early childcare settings and the attitudes of adults can have a really strong impact on children with disabilities and whether or not they are able to play outdoors. So we really have to consider the adults who care for the children and ensuring that they are also informed of the benefits of outdoor play and how to support that. We need policies in play to support outdoor play for all children in childcare settings, which is what the Sprout and Sprout Able study is focusing on, but really beyond, as you heard from Mark earlier. And importantly, the outdoors is a place for everyone, all ages, all abilities. We should all be outside playing and getting the benefits that we know exist when we spend more time outside. And then finally, so the Sprout and Sprout Able study, these are ongoing studies. We're currently collecting data for them, and they were intentionally designed in parallel to explore both the outcomes and inclusion around outdoor play and spending more time outside, ensuring that as we promote outdoor play, no child is left behind. So just a quick acknowledgement, this work is done by a huge team of researchers and collaborators, staff and students. So a big thank you to them and our funders for this work. At this time, I'm going to pass the baton over to Carolyn, who's now going to take it home to CHEO and tell us a little bit about what's happening on the grounds.
Thanks, Megan. Hello, everyone. So if we can go to the first slide. So just a little geographical background of where we're located. So the CHEO school is on the CHEO campus, and it's located in the area where rehab and development department is. It used to be formerly known as the OCTC school. All the students that attend are outpatients, and they all have a primary diagnosis of a physical disability. So we have 5 classes at the school. There's 1 French class and 4 English classes, excuse me. And we have 7 students, a grand total of 35 students at our little school. And our school is a kindergarten school, so our children attend 2 years, junior and senior kindergarten. So 8 years ago, I began teaching. This is my 8th year at CHEO school. And when I began at year 1, if you can just see the little graphic down below, um, prior to my first year being here, the children rarely went outside. They would go outside typically maybe 15 minutes on a warm, sunny June day before getting on vans and buses. But apart from that, going outside and having outdoor playtime was not embedded in their school routine. So when I started knowing this, I knew that I wanted to change that and start some new routines. And why this is so important is that, as was already mentioned with Mark's presentation, many parents and guardians are not comfortable being outside. Plus, there's the constant bombardment from the media about it's it's high UV, we can't go outside. It's poor air quality. There's increased tick bites. Um, it's it's unsafe outside. But compound that with a child with special needs, there's specialized equipment that's required. There's outerwear that's required that's not necessarily something that's bought off the rack. And that with our ever changing climate here in Ottawa and Canada, gear is a big deal. And then compound it all parents are tired, but our parents in particular experience parental fatigue. So, this is why I felt it was extremely important for our students at our school to start going outside. So, today we now have our students outside 40 to 80 minutes a day, daily, and it's all year long. So, it's not just June, it's September through to June in all elements. And our goal is 120 minutes. And why it's 120 minutes? We'll get there. I have faith. It's because children and youth, in order to have the optimal physical and mental health results, need 120 minutes. And so that is our ever lofty goal. So over the course of 8 years here at CHEO School, with the work, support, and help of our educator team, we have now embedded outdoor play into our students' daily routine. So the next few slides, I'm going to be sharing 3 different anecdotes that all relate to the themes, 3 of the themes from the framework that Mark spoke to earlier. So the first frame or theme, sorry, is movement behavior. And now I'll share the anecdote about our little friend. So back up a few years, this little guy is now in grade 1. He had his leaving ceremony last year. When he came to us in JK, he required a walker to move at all times. So from point A to point B, short or long distances. He also has a cortical visual impairment. So his goal when he came to us was to improve his ability to maneuver safely with his walker. And other goals were increased strength, increased stamina, and increased balance. So when he started going outside in JK for outdoor learning and playtime, he's very reluctant to move from a paved path onto anything that was uneven ground. And then when the snow arrived, he would flat out refuse to move at all. And if we helped him and assisted him towards the snow or off a paved path, he would begin to cry. So now this slide is year 2. This is SK. So fast forward to his second year. Lots of hard work on his part, lots of hard work on his educator team, parent support and trust. And he is moving everywhere imaginable. There's nothing that is keeping him from getting down on the ground in the snow, splashing in those puddles on those great spring days. And not only that, he's using his walker less and less. He is independently walking without his walker for short distances and only using it for longer walks. But most importantly, I just want to highlight the mid photo. He is doing a two-handed task, independently raking that mulch all by himself. He is grinding compost all by himself. He is emptying compost buckets that require 2 hands into our gardens. This is him. So during the outdoor learning time over his 2 years with us, he had the space to move as much as he wanted to. He was physically and emotionally supported to reach his goals, and nature played an invaluable role as a motivator. So my second anecdote will be the theme of social capital. So we'll go to our other little one. So this little one has now in grade 2 in a community school. So this student has complex needs that are physical and behavioral. And she had a syndrome that is physically degenerative, and it affected her balance, which resulted in her falling frequently, which added to a great sense of frustration. On top of it, the degeneration it caused and the medication that she was taking significantly impacted her ability for self-regulation. And that directly impacted her ability to develop friendships. However, she adored being outside and she felt a great sense of connection to the nature. And when she participated in outdoor play, there was a marked decrease in her behavioral outbursts. She exhibited great care and concern for all living little creatures. Worms were her particular favorite. She enjoyed creating habitats for them and reminded her peers that they needed to be safe around them. The outdoors allowed her that physical space to have distance from her peers, which allowed her the freedom to interact with them when she felt more regulated. And this greatly helped her to develop the capacity to create friendships. During her outdoor learning time, the concept of care and compassion was fostered for her, which then translated into similar feelings towards her peers. She had so much success outside, and she demonstrated constant joy and delight. The final anecdote is in relation to the theme of nature and environment. And so this little one is with us right now. She has a syndrome that greatly affects her bone density. So her bones are exceedingly fragile. And she uses a wheelchair for mobility, but also to keep her safe. However, when we go outside, in order for her to really enjoy a discovery play, trained educators, we lift her in a certain way to have her get down to the ground to really connect. She is a very inquisitive and observant and consistently asks questions with regards to seasons, plants, animals, and the weather, and she sees the connections with it all. She expresses immense glee when she is in her modified sled sledding down those snowy hills. And for the first time last year, with the support of her educator, she splashed in puddles with her peers. And that was pretty exciting. She is given a safe space to take physical risks. And this has allowed her to make strong connections to the earth and the land. And in turn, she feels a great responsibility to protect her earth. And she was watering the student gardens last year, and this is what she said: I love my planet. I want to take care of the plants and to help that planet. So these are just 3 examples. I could be here for hours sharing examples that all connect to Mark's framework. And there are times when I get choked up just now thinking about all these wonderful things. But now we're going to head over to some parent testimonials. So parents, as I said earlier, aren't necessarily in a space where they feel able to push those limits for their kids outside, and they're not feeling comfortable. And so that's our job to do that. So here's one testimonial. Thank you so much for fostering a love of the outdoors and for pushing H past her comfort zone. Before school, it was hard to convince her to play outside. And now there are days we have to bribe her inside, and we're so grateful. There's a little extra to add to that. Last spring, it was a rainy day and she wanted to go biking, and her parents said no. And she had a temper tantrum and managed somehow to open the door and get out on the deck. So her parents now are like, they're thrilled she's doing it, but it's like, ah! So we'll go to the next testimonial. Thank you for encouraging Kay to take risks in a safe way. Your guidance has helped him to grow more confident. Thank you for also teaching Kay the land acknowledgement. And just a couple more. Thank you for fostering our little guy's love of nature and, of course, of liking all the elements, which you know is so important, as well as all the million other things that you do we don't see but feel. Thank you for doing what you do. The kids and parents are lucky to have you there. And the final one. I believe your ability to treat T like a normal kid is exceptional. We also love how much she is loving outside. So, next slide. So facilitating outdoor play for our students is hard work. It is hard work. It involves assisting them with those that have goals for dressing, and for others, it is dressing them. And when you have a class of 7 kindergartens with all various physical abilities, it's a lot of time, and it takes a team. It takes a really dedicated, hardworking team to get it done. And on some days, it feels even more challenging, though. We are often faced with extreme environmental noise, constant construction, lack of shape, but more importantly, our attitudes. We are faced with the attitudes that important work happens indoors, and work and play that happens outdoors is considered less than or frivolous. But we persevere. And why? Because we know this is important work. We know that above all, every child has a right to play and has a right to play outside. We want our students to have the opportunity to be outside in wild spaces like forests and open fields, for them to have their whole body be used to the best of their ability in terms of movement. We want them, and we know they can all hide behind a tree, they can all roll down a hill, they can all lie on their back and look at the clouds rolling by and feel the wind on their face. And so that's why we do it. And it's important to do this hard work. So, what can we all do moving forward? Well, we can do exactly what we're doing now. We can join and listen and participate, just like Maeghan and Mark have said about this wonderful summit that's happening tomorrow. And we can get together and connect with colleagues and listen and connect to the wonderful work that they're doing, like Dr. Sue Bennett, who's doing amazing work in terms of green pediatric social prescribing, and Dr. Michael Chang, who's doing amazing work in terms of getting kids back to basics. Let's get those kids back outside from as tiny as they are all the way up to 18, 19 and beyond. Let's get them outside. And that way, as we see through his research, it helps self-regulate. We have such an issue in our schools right now with self-regulation. The more outdoor time, the better. For medical professionals to recognize the immense health benefits that nature can provide and share this and encourage this with the parents and guardians that they meet. Advocate. We need people to advocate for the innovative use of space. We have a building that's going up right now, a wonderful building, the Integrated Treatment Center. And let's think about how we can be innovative with the exterior of the grounds. Let's think about connecting with our our Indigenous knowledge keepers and tap into their ideas about native species and plantings. Let's not forget that natural resource that we have called shade, and how we need to plant trees and make these spaces available to all of us to get outside and play all year long. So what do we need to do? Next slide, please. It's time for a paradigm shift. So this is one of our little ones from a couple of years ago. She has kidney disease, and unfortunately she needed to be admitted. But fortunately, her room happened to overlook the outdoor classroom and the shed for the outdoor classroom. So her educators did up a beautiful sign saying, "Hello, Violet." And then just the picture right beside it is now her back outside with her owl class, connecting to the land, and and just living and loving and playing like all children should do outside. So parents, educators, community members, everybody really wants our children to have play become outdoor play, become a priority. And as you see, the research is there based on the findings that Mark and Maeghan have shared with us. We know that our world is experiencing an environmental crisis. And for us and our children to feel empowered, we need to act. So, this is one more really important action that we all need to take. We need to get out and play. As Mark said, we all need to get out and play, all ages. If we get outside and play, we will make that connection. If we make that connection, we will care and we will act. So, together, let's make outdoor play and access to nature a cornerstone of pediatric health, with CHEO leading the way. Thank you so much, everyone, for your time. And now, if there's any questions, feel free to join the chat.
Thank you. Thank you so much, Mark, Maeghan, and Carolyn. This was an outstanding grand rounds. And thank you for giving us a sneak peek at the global position statement. I look forward to being on site at Wesley Clover Park tomorrow for the official launch and for the summit. And it's really a stark reminder for all of us that we need to spend more time outside and less time on our laptops. We do have a few minutes for questions, and I see Dr. Zemek.
I wanted to thank Mark, Carolyn, and Maeghan for an excellent rounds. I just wanted to put a little historical plug in because today is Rowan's Law Day, which for those of you know, Rowan is a former high school athlete who passed away due to concussion. And a lot of what came out of that was don't do exercise after concussion. And Mark had met with me because I lead the guidelines and said, for everything, exercise is better. Mark's conversation with me prompted CHEO to lead several studies on how the importance of exercise after concussion, and it's led to a paradigm shift. I wanted to congratulate the team on recognizing it's not just for illness, but maybe put in a plug for all of us who are clinicians treating people who, for whatever reasons, think that exercise may not be part of the care or may be harmful, and to rethink that as well. Because I know that he forced us to rethink it in concussion, and so I want to put in that plug. And second, just please reach out to me, Carolyn, Maeghan, and Mark. I'd love to have links to those handouts to build into our guidelines because we have a lot of kids that aren't necessarily athletes, but still would benefit from healthy, active living and would love those things, and particularly those who are not para-athletes per se, but people who are not necessarily doing athletes because of their condition. So happy to follow up with you later and have links to those to put into those guidelines and others.
Thanks so much, Roger. And I see Toby put a comment in the chat. Any other questions or comments? Perhaps in honor of this grand rounds, I'd suggest that everyone spend a little bit of time outside today. It's not raining today. The sun is coming out. So please take some time, whether it's at your lunch break or it's at the end of the day, in between meetings, go outside, stretch your legs, and really, really honor the importance of outdoor play. There is a comment in the chat from Sophia. I'm a third-year medical student new to these rounds. Thanks to the presenters for the important talk. For the Sprout study, I was wondering if you specifically observed examples where the parents' or educators' own upbringing and exposure or lack of to the outdoors influenced how the values of outdoor play to their children were instilled. What a great question.
Yeah, that is a great question. Thank you so much for that. So in terms of parents and educators' own upbringing, we aren't currently exploring that in any of our yearly assessments, but what we are exploring is their current attitudes towards outdoor play. So, and their current support behaviors. So how are they supporting outdoor play at home? What are their attitudes towards it? But what we're also exploring, and we will be beginning this after this now first year of the study, is qualitatively understanding the benefits of outdoor play. And this is where we can really get to dive into the parents' own experiences in outdoor play and how that may impact even their decisions to send them to a preschool like Forest Explorers. Thank you so much for the question.
Okay,
Thanks, Megan. So we are at time. Again, I want to thank Megan, Mark, and Carolyn for sharing their information. There are in the chat a link to the Outdoor Play website for more information, and also the Grand Rounds evaluation. Please complete that, and looking forward to tomorrow, and everyone have a great day. Take care.
Thanks,
Cheers. Thanks,
everyone.
everyone.
Have a good day. Bye-bye.